Welcome back to this week's video, and this week we're going to be dealing with an unconscious casualty. So tonight we have two scenarios, so keep an eye out for both of them and we'll have a little chat at the end about it. So here we have an unconscious casualty on the ground, and you can see we have a patient here. If you revert back to our first videos on our primary survey, which is airway, breathing, circulation, that's what we're going to check here now. So we're going to come along. We know it's a medical patient, so we're going to go along. We don't have to worry about trauma. First thing I'm going to do is open his airway. Check inside the mouth, see is the airway clear. The airway is clear, so holding his head back in that position. I've checked his airway. I'm going to check his breathing rate next. And I can see his chest rising and falling. I'm not worried about rates now at the moment. I'll explain why in a minute. I have a steady rise and fall of the patient's chest. And the next thing I'm going to go along and check for a carotid pulse. So I have a good full bounding pulse. So at this moment in time, obviously we've called the ambulance. We're going to go back now and put the patient in a recovery position. So a couple of things I need to be looking at here is then what I'm going to do is get the hand nearest to me, the patient's hand. I'm going to check his pockets for money or anything of that nature. No, but anything like that's sharp, anything when I roll over the patient. And if you notice when I'm checking with the back of my hand as opposed to the front of my hand. And it makes better sense that way. And the reason no one can accuse you of touching a patient then. Next thing I'm going to do is I'm going to lift up the patient's leg, and I'm going to tuck the foot in under the back here. And I'm also going to go along and we're going to put palm to palm as well. So another thing you have to be careful of as well is if you're dealing with patients, and especially ladies with maybe an engagement ring or anything like that, don't take off the ring, just turn the ring inside out, that the stone will be on the front part of the hand. What I'm going to do is, if you remember years ago, some of you would have learned this years ago, we put our hands over and grab the patient here. But for manual handling practices, we're not going to do that. What we're going to do is use the leg as a lever. So I'm going to hold the hand here, and if you watch this then, look, hold the patient over, lift the leg out, move him up here, and by doing that I shift his centre of gravity as well. And what happens now is I can open the airway and the hand will hold the airway open. So if the patient gets sick, what I can do is reassess the patient again. So by checking, putting my hand here on his back, I can feel his lungs and I can see him rising and falling. I'm also going to check for a pulse. I have a full bounding pulse, and I'm going to stay with my casualty as well. If you're in the home environment as well, what you could also do is place a chair behind it if you have to go off and make that emergency phone call as well. But the most important thing here is now I know that the patient has airway, breathing, circulation, and the patient is alive. A lot of people get caught up in this moment and they're thinking, oh my God, what happened to the patient? What am I going to do next? Once we have an airway, we have breathing, guys, and we have a pulse. Technically we won the lottery now at this moment of time, and we're waiting for emergency services. Okay, so welcome to our second scenario. So if you've done first aid courses before, no matter what part of the world, they've always told you that if you had an unconscious casualty, get them onto the ground. That's well and good if you're able to lift the patient onto the ground. As you can see here, I have an unconscious patient sitting at a table. Now, due to maybe medical issues or back issues or something of that nature, or if the patient weighs heavier than yourself, you mightn't be able to physically lift them onto the ground. So what we're going to do here is going to shake and shout, hello, hello, can you hear me? Patient can't hear me. Next thing I'm going to call for help, and I'm going to sit the patient back. Remember, I'm not lifting the patient, but I'm simply moving him back the way. So what happens, I'm going to hold the head, lift him back the way, check his airway, open the airway is clear and patent. Next thing I'm going to check the breathing rate. I know I have a good breathing rate, I can see the skin colour, and I'm going to check for a pulse here as well, and I have a full bounding pulse. The fact that the patient is conscious and breathing sitting up doesn't mean that I have to move the patient to the ground, because I know that once I have a carotid pulse here, I have a relatively okay blood pressure, and we'll discuss that in a few weeks to come as well. Another thing we have to be careful with patients as well is when we're sitting up like this, that if they do slump off, so a great idea is get your body in alongside them and hold on to them as well. If they're lying on a couch or sitting on a couch, when they go unconscious, just swing their legs around and keep them upright. But the most important thing is to keep their airway open. When dealing with an unconscious casualty, it's a very common and standard call for the ambulance service, believe it or not. So when you're at home, yet again, go back to our previous videos, and remember we're looking at scene safety, calling the ambulance, making sure the airway, breathing, circulation. So we have to ask ourselves, what are reasons for people going unconscious? So a standard one would be, on a night out, would be alcohol. People would get a bit wobbly, go down the street, trip over, fall and bang their head. And that comes into maybe a trauma scenario at that stage, but we're going to cover that in a separate video ourselves. So we have medication then, so we have over-the-counter medication, can happen in a lot of older people as well, where they're getting Alzheimer's, dementia, and they might double medicate and they pass out as a result of it. But yet again, the whole management of the patient is airway, breathing and circulation. Other ones then is illegal drugs, which are very common nowadays in all parts of the country and a lot of parts of the world, and especially when you're dealing with younger people at house parties. Done lots of calls like that over the years, and the most important thing is keep their airway open, breathing is going, and circulation, and if the eventuality of anything happening, making sure you start CPR. Diabetic patients are another one. So when we're dealing with diabetes is a very complex disease in its own right, and if you're dealing with a loved one that has diabetes, they will know and understand it. So there's two types, there's type 1 and there's type 2. The one we're concerned is about type 2, and it comes on very fast, and I have a whole video on that coming in the future weeks. Other ones that we covered in our previous videos, we're dealing with stroke. So remember, if a patient goes unresponsive. Now when you're dealing with an unresponsive patient, a good trick to deal with them is that if you're going along, you've checked their airway, breathing, circulation first, put your two fingers inside their hands and talk to them. And in a lot of cases, believe it or not, a lot of people will squeeze their hand. For some medical reason, their eyes are closed, but they're conscious and aware of their surroundings. Going back to our previous videos as well, somebody with a heart attack, just in that prior moment before they go into a cardiac arrest, they may go unresponsive, and you might have to do CPR. So check out our video on that. And there's lots and lots of other medical issues as well. So if you liked our video, lads, please give us a like and a subscribe, and we look forward to talking to you next week.